All right, so now we're streaming. I'm gonna click present. Alrighty, hi everyone. So welcome to our, I think this is the third
Third session.
virtual shadowing session. And today we have Dr. Yazdani. She is a general dentist and she will be talking to today about the importance of oral health on systemic health. So thank you so much, Dr. Yazdani, for joining us today.
It's my pleasure, and thank you for this opportunity. And I think this is a great program, so I'm excited.
Thank you.
Thank you. We are too.
So, okay, I guess I'll start with an introduction. My name is Dr. Yazdani. I got a bachelor's degree in international affairs at George Washington University with a minor in biology. And then I worked for a year doing research at Walter Reed. And then I went to Columbia University School of Dental and Oral Surgery, where I got my dental degree. While I was there, I also pursued a master's in public health. So that has sort of opened some other doors for me here and there. I currently live in Northern Virginia. I have a private practice. I've been a dentist since 1997, but I've been practicing in Northern Virginia since 2006. I also am on a few boards. I'm on a board called Project Turquoise, and it is serves displaced people in the world. So we've been on 2 missions already, and I sort of run the dental medical aspect. And we went to one in Jordan at Camp Zaatari, and the other one we went to Lebanon. I also serve on the board of some other nonprofits for Iranian Americans. So and I live with my husband, who's a cardiologist, and I have 3 children. One's older and graduated. I have a junior at Brown, and I have a senior in high school. And I have a dog named Rumi, who we adore.
Oh.
So that's my background. And you want to know why I went into general dentistry and why into dentistry. So to be really honest, because you guys are all making these decisions, I initially wanted to go to medical school. And the year that I applied to dental school, I applied to dental school and medical school. And I have to say, dental school was really just sort of my father kept saying, it's a great career, you should do it, and it's better than medicine, and you'll have more time. But I was like really determined to do medicine until I went to Tufts University. I never even attended it, but it was my first dental interview, and it was a game changer for me. I just, I felt like, it combined science, you worked with people, you could really have an impact. And at the same time, there was this artistic component. So I love dentistry because I just feel like it challenges you. As a general dentist, we get to do a variety of things that you get to diagnose, you see interesting things, you meet interesting people. So that's my story.
That's very interesting.
Thank you. So I feel really strongly about the connection of oral health and systemic health. And I feel like if you want to pursue dentistry in the future, I want to impart on many other dentists as well that it's really, really important that we're aware of this connection and that we use it in our practices every day. Because I think we can improve the overall health of the populations we're serving. So I think the mouth is the gateway to your body. And in my presentation, hopefully by the end, you'll be convinced it is as well. And I think if you really can influence your patients to have a healthy mouth, you are leading them to also having just being healthy overall. Okay, so let's define oral health. What is oral health? So I took this from the World Health Organization, and actually I can't see the whole screen now. So why don't one of you read it for me? I mean, I know what it is, but I haven't memorized it. Does someone want to read it?
Yeah, sure, I can read it. So, oral health is a state of being free from mouth and facial, oral and throat cancer, oral infection and sores, periodontal or gum disease, tooth decay, tooth loss, and other diseases and disorders that limit an individual's capacity in biting, chewing, smiling, speaking, and psychosocial
Psychosocial
well-being.
well-being, yeah. So as you can see, it's really, really important. I mean, just by its definition itself, you can see all the different components involved in being a dentist and what you're treating, and also on someone's, you know, in order. I mean, if you can't eat, then you know your overall health is going to be affected. If you can't speak, that's also a problem. So anyway, but we'll get even further into it later on. So you can go to the next slide. So here I'm going to get right into it. Like the biggest studies that have been done, and they started at first in Harvard, was finding the link between gum disease and heart disease. And so you guys have heard about plaques in your heart, and how you get blockage in the heart, and then people go in and they get angioplasties to, I mean, there's surgical ways to fix it, there's non-surgical ways, but obviously blocking the arteries in your heart is not something any of us want. Well, studies have found that the exact same bacteria that blocks the heart also is found in the plaque and build up in your mouth. So a lot of people say, well, how is that possible? How does it get to your heart? Well, you're going to learn that your gums are extremely vascular. And so any bacteria in your mouth and your gums will travel to other parts of your body, especially your heart, where we all know blood goes and gets oxygenated. So the bacteria from the mouth, as you can see, and I don't know if you can all read that, it basically sticks to the plaques in the bloodstream, and then you end up with the blockages. And actually, interestingly enough, my husband also does this for a living, and they use a lot of the same burrs and hand pieces we do to break down the plaque. So, and also the other thing that it does is trigger an inflammatory response. So you'll also see that you know, bacteria in the mouth, and especially vascularly, can cause a lot of strokes and other problems. And then if you look to the right, you'll see, first of all, bacteria from your mouth can enter the body 3 ways. I mean, I'm sure you all know this, but it can enter your body through your bloodstream that we just learned, through your gums. It can enter the body through your digestive system when you're eating, and it can enter the body through your respiratory system. So that is why you're at risk. Actually, I just recently attended a talk that was so interesting. It was with the dean at SUNY. If any of you are applying up there in New York, the dental school. And just because of everything that's going on with COVID, they were finding that people who had periodontal disease were much more likely to be on ventilators and for longer, just because of the complications and we have always known that a lot of people that you'll see in the hospital that complications with pneumonia, actually, it's because they have periodontal disease, and that increases the time they have to be on a ventilator. So especially when you're being intubated or anything, when you guys go to dental school, and I wish this was practiced more in private practice, you really shouldn't have any surgery, elective or non-elective, without getting sort of a dental screening, because you don't want to go into surgery, getting anesthesia, introducing bacteria into your respiratory system. So a lot of people still will, I'll tell you, orthopedic surgeons are getting a lot better. I'm getting a lot of people who are not allowed to get clearance without a dental clearance. Definitely anybody who's doing transplant, that is just, thankfully for that, they have to. I had a patient last week was getting a transplant. They have to get clearance from the dentist, but it really should be for all procedures. I mean, even cosmetic procedures, one of the biggest failures of silicone, actually, breasts are because of dental bacteria. But if they had just got a cleaning and had 2 weeks before the surgery, they would decrease their risk over 95%. So I think that's really interesting. But if you look, so you get gum disease, you're at risk for heart disease, diabetes, erectile dysfunction, pregnancy problems. So I'll get into that later. That women who get pregnant and have periodontal disease basically are at high risk for hypertension and having premature babies. So there are a lot of links here. Okay, next slide. If I'm going over on time, stop me, okay? So
You're good.
I don't know how advanced the students here, what sort of your dental knowledge, but I just thought it would be helpful to sort of go through the dental anatomy. So we're going to do a little dental anatomy 101. So the outer layer of your tooth is the enamel, and you can think of that sort of like the eggshell protecting your teeth. The enamel is if you get a cavity in the enamel actually, and it never passes into the dentin, it's actually 100, you can reverse that with good oral hygiene. We see it on x-rays all the time, and we tell people, instead of drilling, do these things, and 40 years later, I can take x-rays, it'll still be there. We can actually reverse the disease process in the enamel. Once it hits the dentin, you have to go in there and you have to remove that decay, because if you don't, then it travels to, you can see the pulp cavity. And if you've heard of anyone who needs a root canal, that's exactly what's happened. The disease process has gone from enamel, dentin. Once it hits pulp cavity, at that point, you have to take out the blood supply and the nerve. No one has a choice. And then once you take out the blood supply and the nerve, as you probably know, anything without blood supply, or whether it's your arm or your tooth, it's dead, it's brittle, and now you have to get a crown. So that becomes, so a little cavity is probably what, a couple $100, but now you're talking about, depending where in the country you are, almost $2,000 for a root canal and another $2,000 for a crown. So look at the difference of getting into a dentist earlier, getting diagnosed earlier by having routine x-rays, both financially and invasively. It's much better. Nobody wants to take their nerve out and their blood supply for their tooth if they don't have to. So then if you see that, you just see the root we have the tooth, and then we have the attachment apparatus, which is going to be your bone, ligaments, and your gums. So you can see the bone there, and you can see the ligament. It's the pink surrounding the tooth, if you want to show them, Krupa. Yeah.
Right here.
Exactly. Someone grinds or clenches too much, if you look at an x-ray, that whole ligament will be widened. So sometimes just from that you can tell. So that's my tooth anatomy, and we can go to the next one. So I wanted to show you healthy gums. So we always say pink, firm, fibrous gums. That's what we're looking for. Happy gums are pink, they're fibrous, they're firm. So the first picture is showing a set of teeth with healthy gums. The second one is showing someone with gingivitis, where once you start getting bacteria, I mean, I always tell the kids and the teenagers, your gums are so angry, and angry gums will start bleeding. And sometimes when people floss, they'll get so nervous, they'll be like, oh, my gums are bleeding. But that actually means you need to keep flossing. And if they actually continue flossing, they'll see that they can stop the bleeding. Now, the third one will show advanced disease. And with that, you'll have to go to a dentist, because that means you probably have calculus buildup way underneath your gums. And no matter how much you clean it, until you get that professionally taken out and given a chance to go back to number one, that won't happen. And if you look at the bottom teeth in the third picture, you can see how the bacteria will start causing your gums to recede, and you'll actually start getting attachment loss. So sometimes you get people who will say, I've never had a cavity in my life. But like, the lesson you want to teach them is that you have two responsibilities in your mouth: to take care of your teeth, which hopefully with good fluoride and, good preventive care, you won't get, and good diet, you won't get cavities. And then you have to take care of your attachment apparatus, because if you don't take care of what's holding your teeth and housing your teeth, then you're never going to, even teeth without cavities will become loose and fall out. So that's the gum. You can go to the next slide. So now I want to show you guys x-rays. Again, I don't know how much you guys have been exposed. So Krupa or Isa, if you guys want to tell me like that we already know this, I can stop, But this is not a healthy mouth. I hope you can all tell. There is extreme bone loss. Where the red arrow is, you can see vertical bone loss. On the bottom first and second tooth, the first and second. Can you go take the arrow to the tooth all the way to the The last tooth.
One second. Oh, the first one on the right.
Yeah, sorry. That's horizontal bone loss. But then let's go to the third and fourth. Yeah, that is where the bone should be, even a little higher. So as you can see, this person that we're seeing their x-rays, they have a lot of bone loss, and so they have periodontal disease. This person is a high risk person for heart disease. For if you see someone like this, you're going to suspect they must have really high sugar too, and probably have diabetes type 2. So a lot of people have heart disease also have diabetes type 2. Also, when people tend to have a lot of buildup with calculus, they also probably have high cholesterol. Like, I don't know if any of you have gone to a cleaning and you have, people get that under their front teeth in the back, sort of like a bridge of calculus. That doesn't mean everybody who gets that has high cholesterol, but a lot of times people who repeatedly get it, even when they go to the dentist, that in their mouth, they have the enzyme marker, which means that they probably are either genetically or their cholesterol is high and they haven't been diagnosed yet. So again, that's something a dentist can tell. I've told patients all the time, have you gotten your cholesterol checked? Because unless they're not cleaning well and not following the instructions, they shouldn't be getting that buildup. So if you could show them sort of the calculus buildup,
Mhm.
there's one, good job, Krupa. And on the bottom,
Well, they all have arrows on them, right?
oh yeah, that helps. Okay, so plaque, once I can see plaque on an x-ray, that is a huge no-no because plaque is soft. So once plaque calcifies, it means it can, because we can only see calcifications on x-rays. Like I can't see any of your gums or gingiva on this x-ray. I know where the levels are because I'm now experienced, but I can't see any of it on an x-ray. So and I can never see soft plaque on an x-ray, but if I can see calcified plaque, and that is the plaque that gives the big red flag for the heart disease. But I also want to show you guys some cavities. So
Mhm.
you want to show them the cavities because they haven't picked it up. There's a cavity. And that cavity is actually, you might say, oh, it's so easy, just go in there and clean it, but it's way under the gums. Then there's a
Mhm.
cavity at the top too.
The top.
Second
Which,
tooth, second tooth,
um,
between the first and second tooth, where the enamel is. There
oh,
you
the
go. Yeah,
this.
very good. There's a cavity. See how it's broken? So that is, if you look at it, I mean, your eyes have to get used to it after you guys read a lot. You'll see that has gone past the enamel. It's not something we can reverse. It's something we'll have to drill. So if you ever see white fillings like this, guys, it's usually the old metal amalgam fillings that hopefully by the time you guys go to dental school, they're not teaching you how to do them or use them anymore, because I think about 80% of dentists in this country don't use amalgam anymore. Even though there's no studies to show mercury causes problems, why use mercury when we have other materials? The third one on the top is actually a composite filling. You can see how it's not as white, it doesn't have metal. Sometimes they'll put like quartz in there and everything, so we can tell the difference. They used to not put quartz and it would show black, and we couldn't tell the difference between the filling and a cavity. But now now that they put the quartz in, you can see that we can see where the outline of the filling is.
Mhm.
Okay, you can go on to the next slide. So like I said at the beginning, I think that the mouth is sort of the window into the body. We've learned how there's 3 different ways bacteria can enter. And a lot of things when you see in the mouth, you can make diagnoses. And I'll give you some examples. If I have a patient who comes in just, cleaning every 6 months, and then all of a sudden they come in and I'm seeing like advanced, like moderate bone loss. And I'm like, what happened? Like last time your bone levels were fine. You didn't have pockets, but we'll go over oral hygiene. Did you have any surgery where you weren't able to clean your teeth? And if they're like, no, doc, I've done everything the same. Most likely that person is sugar levels are going through the roof, not controlled with any medication, and they probably have diabetes type 2 and don't even know it. So a lot of times dentists are the ones to refer people to see that, because, as you know, high sugar levels and diabetes type 2 destroys all your organ systems, your eyes, your legs, your kidneys, and your mouth is one of the places you'll see the signs first. And so that's one sign. Another thing is a lot of people are taking medications for many different things, but I can tell you that high blood pressure medication, I can tell you a lot of the anxiety medications, also ADD has become so common. A lot of the medications for that, they all cause dry mouth. And dry mouth lowers the pH of your mouth. And when the pH in your mouth is low, you guys will learn later, bacteria likes to grow exponentially. So you become at much higher risk when you have a dry mouth to getting decay, especially at your root surfaces and between your teeth. And we'll start seeing a lot of people. So like managing dry mouth becomes a huge problem for dentists, and people have to take their medications. So so there's also other disorders. Sometimes if we see people with thrush or fungal infections, we'll know that there's something autoimmune going on. So anyway, those are some examples. Then also, like we've already talked about, how if you have bacteria or infections in the mouth, you risk having infections and disease elsewhere in the body. Also, we've already talked about the medications, that when you treat systemic diseases, you sometimes cause problems on your oral health. The oral health diseases are so widespread, but in the world, actually, this latest studies say 60 to 90% of children worldwide have dental caries. I mean, luckily in the US, it's a lot less, but I will tell you, we're seeing a huge increase in the US too, for a number of reasons. People are not drinking the fluoridated water, and they're drinking bottled water when the kids are young. And also just the diet in the US with all the fast foods. I always tell people when I give this talk, if you can leave this talk with anything, go home and educate your families and everyone to start shopping the periphery of the supermarket. Like the middle aisles are killing all of us. Like food doesn't have to have a shelf life of, how long, you can, so just try to be a hunter and gatherer, and try to teach your patients that too, because those people have healthier mouths and healthier bodies, I tell you. So next slide. Okay, there was a study in Finland where they studied, and they showed that it was really scary, because they took 75 patients, and 79% of the patients who had strokes had the same mouth bacteria. So that was like huge evidence-based study, that there is this link showing that, bacteria from the mouth can cause, stroke. So why it's so important to have preventive programs. You can go to the next one. So oral health is so important throughout the lifespan. And if you can get in earlier, you can really prevent a lot of the problems in adulthood. For conception, like if I could give advice to every woman who's about to get pregnant, is like, please have your dental cleaning, because afterwards, we've seen it. It's so hard to manage. There's actually something called pregnancy gingivitis. There's called pregnancy tumors. And I know you guys have Google, so just Google this stuff and you're like, oh my gosh, you don't even want to see it. It's scary. But the worst part of this, that bacteria is causing hypertension in the mom, and the hypertension in the mom is causing a premature birth. So right there, just a simple having your teeth cleaned every 6 months can prevent a premature birth. As infants, you guys have probably all heard of baby bottle syndrome, where I don't know if you guys have worked in any dental clinics, but kids who fall asleep with the bottle in their mouth, that last drop of milk basically rots all their teeth. And it's bad because people think, oh, baby teeth aren't important, but they're very important, because first of all, it affects the jaw growth of your jaw. And you'll see people coming from third world countries where they thought, oh, it's baby teeth, we can just take them out. And they have major problems with bite and their jaw didn't even fully grow because baby teeth were taken out prematurely. The other thing that can happen is with the baby bottle syndrome, as the kids become toddlers, it has a huge impact on them psychologically. It's embarrassing to walk around with all black teeth, and you go to school, they're shamed, they don't want to speak. So psychologically, it's not good. And also you have disease process in the mouth, and it's financially, it's very expensive because these little kids have to get root canals and crowns and lots of work, thousands and thousands of dollars of work. Early childhood, adolescence, the most important thing is fluoride, fluoride, fluoride. So this anti-fluoride movement just drives me crazy. I'll put that out there right now. And I think actually fluoride is natural. It comes from rocks. It's not, and in moderation, it's one of the best public health initiatives ever taken in the world. So I think that all kids should have access to it, obviously, and not, you can over fluoridate, but at Columbia, the worst case of over fluoridation we saw was someone who lived and drank spring water all his life. So he got the fluoride from the minerals of that spring water. It wasn't even, but I know that some people live in areas without fluoride, and sometimes pediatricians will give it with the vitamins when they're younger. Sometimes you don't control the amount, but I can tell you that through the water system is the best way. Cook with it, give it to your kids, don't use bottled water. And also diet and nutrition. I don't let a kid walk out of my office without asking them what their healthy snacks are. Like, you need to start all this stuff really early, because once they get to adulthood, I mean, I'll tell you later why. We're going to get to slides and I'll tell you why. So basically, oral health is so important throughout the lifespan. I just thought this was really interesting, and I'll tell you later why. It's for European Union, but I should have found something US, but I'm sure we're similar because our healthcare, we spend so much more than them. But if you look at the three most expensive cost of diseases, is diabetes, cardiovascular diseases, and oral diseases. I mean, 79 billion euros on oral diseases, 105 on cardiovascular and diabetes. So the reason I find that so interesting, because if you look at the rest of them that we spend a lot less money on, these three, and for cardiovascular, I'm not talking about anything genetic. And for diabetes, I want to clarify, I'm only speaking of diabetes type 2, not type 1. And for cardiovascular, I'm talking about high blood pressure. I'm talking about high cholesterol. They're all 100% preventable and reversible. So that's a huge problem right there, right? Because with the right nutrition and with the right, like, taking care of their health, and we as dentists are in a really unique position because we get people early. So when we're preventing oral diseases, we're actually also helping them prevent diabetes and cardiovascular disease. Diabetes is just eating excess sugar. And I mean, now I'm sure all of you know, I hope they're teaching this stuff in school, but it's not just candy. It's rice, it's spaghetti, it's any carbs turned into sugar. Bread, I'm not saying you shouldn't eat them, but they did a study that in 1905, the average person had 5 grams of sugar per year. And when they say sugar, it's, like I said, all carbs. Do you know what it was last year? Any of you can guess? Sorry, it was 5 pounds, not 5 grams. 5 pounds in 1906. I'll let Krupa guess.
1906. Okay, 5 pounds. I mean, I
Per
feel like
year.
it's so much.
Average person. I'm not talking about anyone obese or unhealthy. I'm talking about average person had 5 pounds in their diet per year.
I don't want to guess too high, but like maybe 30, 40.
It was 150 to 200 pounds. Again, middle aisles, guys, sugar is the #1 preservative. Corn syrup, corn is subsidized through our government. And then we make corn syrup, and everything, all those cereals, those soups that are in a can, everything has got corn syrup, corn syrup, corn syrup. So do you see the difference? And I just want people to see the amount of money being spent. Like diabetes type 2 is 100% preventable, and it's reversible in early stages. So is cholesterol, so is blood pressure. Literally, if these people just lose 30 pounds, they can reverse it a lot of times. So next one.
I am so shocked.
So there's a common risk factor approach, which a lot of um, public health sort of initiatives are using programs around the country. Because one thing you'll see is like dentistry always has sort of dental initiatives, and then they have other initiatives for other health things. I'm saying, come on, bring these together, integrate these together, because a lot of the common factors that cause cavities and gum disease and oral cancers also cause all these other problems. Cancers, heart disease, respiratory. So this is totally different. This is not like if you have cancer in the mouth. This is just saying there are risk factors that will cause, problems in the mouth. And if we approach those earlier and put these programs, initiatives that will sort of aim at the risk factors rather than trying to actually already the disease is already there, then maybe we can prevent the diseases. So if you go to the next slides, I'll give you some examples. So smoking. As oral health professionals, you'll see that you will be taught in dental school that you should sort of advise people not to smoke. Again, are insurance companies good about reimbursing it? That's a whole nother issue. So it becomes a moral and how much time you or your hygienist has. But smoking can cause oral cancer. So 90% of them are from smoking. It can cause lung cancer. It can cause painful lesions. It also is a big risk for periodontal disease, bone loss. 3 things cause bone loss. Poor oral hygiene, the top 3 things, smoking and diabetes type 2. So for you guys just to know, people who have loose teeth and lose their teeth, it's 3 risk factors, those. And so tobacco is one of them. And that's why you can get premature tooth decay and loss. Now on your general health, obviously we all know it causes all kinds of cancer, coronary heart disease, stroke, respiratory disease, and diabetes. So here's a common risk approach. If we just sort of have an initiative at stopping tobacco, we stop all these problems. Alcohol. Alcohol can cause oral cancer. It can cause dental caries. And it can also cause accidents because you drink too much, you fall, you break your tooth. On the overall health, against cirrhosis of the liver, cardiovascular disease, and cancers. Diet. Can you tell I'm really into diet? So diet, this can start really early, and it can, most people have cavities because of a poor diet. And also they lose their teeth because of it. Poor diet and poor hygiene is a worse combination. On your general health, we already talked about cardiovascular disease, diabetes always comes up, but cancer and obesity. And obesity is also leading to all these things. So we see people very early, not everyone does. So I know the pediatricians do, but if we could work together to sort of make society healthier, we should be able to provide these services too. So strategies for improving oral health for everyone. I think everybody should have access to fluoride. I think it's the most cost-effective measure to prevent tooth decay. So getting fluoridated water around the world to me is something that would be a game changer. Obviously, if you want to be a dentist, and you have to really believe that those maintenance appointments make a big difference. And I'll tell you, they make a huge difference. I saw someone the other day that was 98 years old, has never missed a 6-month cleaning. And I'm telling you, I should have taken pictures of her mouth, but it really makes a difference. And I'm wondering why all my healthy 90-plus-year-olds all have their teeth. There's got to be a common factor there, guys. All my patients who are really elderly and really healthy, they all have, I'd say, most of their teeth, like maybe missing one. So, and then nutrition, like really incorporating nutrition. You can go to the next slide. So, yeah. So what I was, again, we have shared risk factors, and I don't know why dentistry isn't a subspecialty of medicine. We could all go into the history of it, and maybe at this point with everything going on in medicine, dentists are happy they're not part of it. but really it doesn't make sense. If you ever know anyone who has a dental problem and goes to the emergency room, even though medical doctors are so well trained, it's a nightmare. They cannot handle any dental emergencies. And here's this, or this is, the mouth is part of your body, but somehow it became its own little division. So I wish there was more of an integrative approach between sort of oral and the general, all different specialties. And also, again, like I wish that we knew I'll go to the last thing. I really want to shift everyone from this vertical towards horizontal approach. We're basically, the way our healthcare system is, including dentistry, is we're just dealing with the problem, but we're not going, if we had a horizontal approach, again, like where we incorporated nutrition and health and really gave the importance of prevention, then we would be helping everyone instead of just someone's just treating the problem. You have diabetes type 2, I'm going to give you all these medications, but I'm not going to tell you that if you don't improve your oral health, it's going to even make it worse, because you're going to have all this bacteria. Then you're going to develop heart disease from your existing diagnosis of diabetes. So really, we should all start, if you want to be in a health profession, even if you want to be a cosmetic dentist, you want to be an orthodontist, whatever, we really have to take a horizontal approach. I mean, really, even orthodontists today are finding out that they are diagnosing, believe it or not, sleep apnea before a lot of other people, because they're just taking a Seth and they're like, oh my gosh, this airway is so narrow. Do you snore? It's just a matter of asking the right questions. And as a dentist, you can find out so many things about their overall health, and you can help them improve their health, and rather just, oh, you're coming here and just make your teeth look really straight because you only care about the front teeth and you don't even care about the relationship of your upper jaw to your lower jaw, how it can affect other areas in your body. Okay, we can go to the next one. So anyway, I just think healthy mouth, healthy body, and I have little resources for people because I'm really into tongue scraping. So these are my favorite little things. So I always put them at the end. I think that burst toothbrush is a great toothbrush. My favorite mouthwash is Closest. My favorite toothpaste is Sensodyne. And just so you all know, I think it's the only one made in the United States. And my favorite is Pro Enamel, actually, from Sensodyne. And it is a little bit more expensive. And some people will be like, it doesn't foam up and it doesn't have that minty taste, but they did a lot of studies that without those fillers, actually the fluoride uptake is better. So those are just some things I put at the end. Any questions?
Thank you so
Yes,
much, Dr. Yazdani. That was a great presentation. I'm going to open the floor to questions if you don't mind.
Sure.
Okay, so the first question we got was, what kind of community work do you do for Iranian Americans? I would like to learn how I can help my community.
Well, I don't do anything with dentistry, but I'm really, I was born and raised here. So most of the Iranians immigrated here after 79. Now I'm going to give my age too. I was born in 68. So I actually have never had the pleasure of living in Iran, but very proud of my ethnicity. And I basically am involved with organizations of just trying to building community and actually building a community in the Washington, D.C. area, and just getting people more active in civic participation and different services, legal, social. So really just building a community center.
That's great to hear. Thank you. And then I know that there are not any particular major that you need to study to get into dental school, but do you recommend any major that may be beneficial for those who want to get into dental school?
So I'll tell you this. If you have, I mean, they confuse you, these dental schools, because they want these diverse individuals. They want people who've studied other things, right? But I'll tell you, when you come in with no science background, it's a lot more challenging. And if you talk to anyone, but then at the same time, if you get a biology major or a chemistry major, they kind of like, oh, what makes you stand out with all the other biology and chemistry majors? So I would advise, I love international affairs. I took it as my major, but it might be more wise to sort of pick a science major, but pick something else as a minor and just get really involved in extracurricular activities. I mean, they love to see leadership. dental schools love leadership. So wherever you can, I mean, this initiative of starting this dental shadowing is awesome. It shows, you know, it's first of all, you're spreading knowledge, you're collaborating with experienced dentists. And also, I mean, I think it's anything like that. They just want to see you sort of, you know, showing leadership, making a difference. I know you guys are like, everyone tells you that, but I do recommend having at least a minor or major in some sort of science program. I strongly recommend that. And I also feel, I don't know, you guys know more, but I've had interns for the last 5-6 years. 3 of them ended up going to dental school. I found that they all had to sort of do some sort of master's program or some sort of work related in between. The other 2 actually went into master's programs to go to dental school and decided just to stay in the field of their master's program. That happened with medicine before dentistry, but in my age, it was easier, but we're talking 1993 to get in right after undergrad. I think today this is not the case. Is that true when you
Yeah,
talk to people who are-
it does seem that way. I've heard a lot of people like go into master's programs before applying to dental school to kind of like gain more experience and things like that.
Yeah, I've heard the same thing, but I've also had friends who went straight from undergrad. So I guess it depends on the school.
So maybe it's like a 50-50, or, I mean, it's just a lot more competitive, right? To get
Right,
in.
yeah.
Yes. Hmm.
So what are some of the other reasons for root canals besides dental cavities reaching the pulp?
Trauma. If someone, have you ever seen a person with a gray tooth up front? And the interesting thing about trauma is that it can take years for the tooth to die, years and years. So, I mean, I could get a 30-year-old in my office and their tooth is like changing color. And then all of a sudden we'll be like, did you ever fall when you were younger? Or, I mean, literally that 30-year-old could have had a bicycle accident at 10 or playing baseball and someone hit them. So whenever you have trauma to the tooth, that can also cause a root canal. So another thing is, I mean, trauma sometimes is getting work done. So, I mean, when we use a drill to take out the cavities, but I mean, that's a risk you always take, but that's maybe 10% of the time. Sometimes the trauma from the drill and the tooth already had a large cavity. Well, you'll get a pulpitis in the nerve and it will be irreversible. So here are the signs if you care. I mean, like you guys care. If someone has 2 out of 3, if you tap on their tooth, it hurts. And then they have cold or hot and it lasts more than 30 seconds. The rule is if it's less than 30 seconds, and it might be a reversible situation with like giving fluoride and desensitizer. And the last is if you go up where the root of your tooth is, I mean, under your lips, and it's called palpate. You press on it, basically where would be the apex of your root, and that's where the abscess would be. If you press on that, tap it, and they both hurt, you need a root canal.
Thank you. So how do you distinguish between the enamel and dentin on an X-ray? So I think it might be easier to go back to that
Yeah.
slide.
Go.
Sure.
So I mean, this poor person has had every tooth filled, so it's really hard, but go to so see the outer layer of the tooth? You should be able to, I wish I had the arrow I could show you. I'm doing it with my arrow, but can you try to do it, Krupa?
Is it this tooth, the 4th one on the bottom?
I mean, all of them, even the ones with fillings, you can show the enamel. See, you can,
Mhm.
do you see how there's a difference between the enamel and the,
You mean like the darker portion of the top?
so go back to that tooth that I showed you at the very beginning, and then let's come back here. Okay. So you see this, you should see this on the X-ray on every tooth, even though the filling. See the outer layer says enamel?
Mhm.
Now go back to the X-rays.
It looks a little more transparent than the other parts.
Well, I
is
guess
that
I
right?
can read them really well because I can tell the difference between the grays, but it would be the light white outside. And then the second layer, the dentin, would be gray color. And then the third, if there's like a butterfly looking thing, let's go to the second tooth.
So like this.
No, the second tooth on the bottom.
This one.
Yeah, look where the arrow is pointing all the way down to build up. Now go to the left, there. Now go up and follow the enamel up all the way, go, and then go to the right. Now you have the filling, but you can come all the way around, come back down. That's enamel. Now go to the second layer, go in. Yeah, that's dentin, dentin, dentin. Then come down to that thing that looks like a butterfly and darker. That's your
This
nerve.
middle.
That's your
Mhm.
nerve. I feel like it looks like a butterfly, but maybe I have a weird idea of what butterflies look like.
No, I see.
Now I go to the tooth next to it. I mean, the third tooth in, no, to the left. Look at that, just one big canal. They're much easier to do. And then go to the tooth next to that, and you'll see the front teeth are the easiest to do because they just have one huge canal. Now this one might have one in front and one in back because this is a two-dimensional X-ray, and you know, our teeth are three-dimensional. So if you go back to the second tooth, no, the second tooth on the bottom.
Oh,
Yeah,
sorry.
it looks like it only has two roots, right? But that's a three-rooted tooth. So there's at least three nerves in there. There might even be fourth. Now go to the back one, the first one on the lower. These roots have fused together, but there's still multiple nerves. Can you see that?
Mhm.
Anyways, I'd have to like teach you. You're gonna when you go to dental school, you're gonna have radiology every single year. So you're gonna learn to read these so easily. It takes time. Any other questions?
Yeah, let me see really quick. Can the amalgam fillings make it harder to see other issues on the same tooth in the future?
Yes, very good question. It's always easier to diagnose a virgin tooth. Unfortunately, it's really a challenge for us to see if there's decay under existing amalgam fillings. So there's a lot of debate on that amongst dentists, and I don't think anyone's right or wrong. Some people will routinely take out all amalgam fillings and they'll replace them with composite fillings. I don't do that because I have some amalgam in my own mouth that's been there. I kind of go with the theory that if there's something wrong with it, if I check clinically and there's like an open margin where I can put my instrument in, or, you know, you'll see fractures, mostly marginal integrity, then I will, and sometimes you can see on the X-ray underneath, but then I'll take it out because my theory is that when mercury is in solid form, it's a lot safer than when it vaporizes. So every time I put a drill in there, the aerosols, I'm causing that. But we have to do it a lot of times because I'll tell you something, most of these amalgam fillings, like that second tooth on the bottom there, 90% of them become crowns. And I'll tell you why. They're much better than the tooth colored fillings, the composite, as far as marginal integrity. Like you can see people with amalgams for 30 years, but the tensile strength of the amalgam is higher than your own bone. So every time you chew and eat on your teeth, the walls that are supporting the amalgams are getting little fracture lines, little fracture. The most common thing we'll see is someone coming in, I broke my tooth, and the amalgam will still be there, but the wall that was supporting it will break off. So amalgams have a higher tensile strength in the tooth, and we found over time that leads to crowns. I mean, it's a good money maker, I'll tell you honestly. Now, the other problem with composites is that they have to keep being replaced because they have shrinkage. They've gotten much better over time, but you'll find the composites, you place it, looks beautiful, has great marginal integrity, and then over time that material shrinks. And obviously, if you have a separation between the filling and your tooth, this is an entry point for bacteria. So I'll tell you that they've gotten much better. The rule is that composites have to be replaced every 5 years, but I've been practicing since 1997, and I'll tell you that I don't find that to be the case. I think it's just a lot more complicated to put a composite filling, and it depends on the user. If you really follow the steps and you're patient with it, then you can get perfect composites.
Thank you. So this is kind of a debatable question, but do you see a future with orthodontics, especially with Invisalign being so popular now?
So I think it's called Smile Direct. Are you guys familiar with that?
Yeah, that sounds
Mhm.
familiar.
So they sort of started this company where people could go for a fraction of the cost. And I think in New York City, they had locations everywhere. And if I was going to be brutally honest, at the beginning, my millennials would come and they really had great results. Like you're like, wow. And they only paid, I don't know, I think they told me they paid 2,000 or 2,500. But on the flip side, I had a patient my age, heard about it. Why not? Instead of paying 7,000, 8,000 at an orthodontist, maybe 5,000 at a general dentist, I'm going to pay 2,500. I will tell you that she ended up paying more than $10,000 to $15,000 on gum grafts and dental work because no one's monitoring them. So if you move teeth too quickly, roots resorb. You'll see this later. Like you see patients and you want to be careful. Like, when did you get braces? Especially adults getting braces. They all of a sudden have these dwarf roots. Like literally the crown of the tooth is the same as the root of the tooth. That is not, your root is supposed to be 2/3 of the tooth. So if you have a crown and a root the same length,
That's an issue.
Scary. But I've seen it. I'll bring cases or I can send them to Krupa so she could share with the group. They have, we call them dwarf roots. And most of the time it's just, they got adult braces. Nobody was monitoring with radiographs. No one was checking the movement, mobility, ligament loss, bone loss. If no one's monitoring you, that's pretty scary. So I think actually they've now started to get a lot of lawsuits, and I don't know, I hear from people that they don't think they're going to last. So you're right. I can't say the future, but I will tell you that orthodontists, a lot of general dentists have started to do Invisalign, but they've done it for years. And orthodontists are still one of the most lucrative specialties in dentistry. So I don't see it affecting that. I mean, I do Invisalign. I know a lot of general dentists that do Invisalign, but like complicated cases like cross bites and class 3s. Do you guys know what a class 3 is?
No idea.
Your lower jaw. No, basically your lower jaw. So the relationship should be the upper jaw. The lower jaw should be behind the upper jaw. So that's a class 1 is, the bite that everybody wants. A class 2 is when your lower jaw is too far back. So you kind of will see the person without a chin. And a class 3, if you just think of it as your chin, you'll get is when the lower jaw is too forward. So class 3, lower jaw is too forward. Class 2, lower jaw is too far back. And ideal is you want a class 1. So a lot of the complicated cases will still go to orthodontists. And also, general dentists don't want to deal with kids because their compliance is off, and they need like a office with all the bells and whistles. But in general, orthodontists, I don't think orthodontists will be hurting ever anytime in the future. And also, orthodontists are really, really getting into sleep apnea. They're diagnosing it in kids very young, and they're also diagnosing problems with the adenoids. And I can tell you, my friend who's an ENT says he is so impressed that he gets more referrals that are accurate from orthodontists than he does from pediatricians. So
That's interesting. Thank you. Can you speak to how tetracycline causes a color change in teeth?
yeah, it's basically we don't give it anymore, but if a lot of pregnant women used to take it, and they used to give it to kids when they were younger, when their adult teeth were forming. So it's an internal stain. There's nothing to be done with it. You can try to bleach it. I mean, I had one case that bleached well. It was unbelievable. But I think most of her staining, it's also the location. If it's like if they have like bigger lips and like it's at the lower third near their gums, then they're really lucky. But unfortunately for tetracycline stains, if it bothers a patient, the only option is veneers, which is not the worst thing in the world, but they definitely have to cut down the teeth. There's no other solution.
Right. I'm going to take one more question if that's fine with you.
Okay, that's fine.
When are tooth implants necessary?
When you're missing your tooth. And does anyone, I mean, this is not interactive, but I'd love to see if you could guess what the number one reason for implants is?
I mean, you would get an implant when you don't have a,
Rupa, huh?
like you would get an implant when you don't have a tooth.
Like, what's the
maybe
number one
after-
cause that I have to refer a patient when they come in? Not if you're already missing your teeth, but what's a cause for you to have to lose your teeth and get an implant?
Like bad oral hygiene.
Failed,
Bone loss?
failed root canal.
Failed root canal.
Yeah. It's
So
the
they would have
number one
to,
reason people lose teeth today. Yeah.
would they get it extracted during
So
the root canal?
some people will advocate, forget the root canal. You know, why don't you just get an implant? I personally feel like having your own teeth. I don't have an implant. I don't know, but I talk to some people and they say that you just know it's something different. And other people are like, I don't even know where I did the implant in my mouth. So,
Mhm.
but yeah, it's failed root canals. But you get an implant whenever you're missing a tooth. Some people are born without some teeth. There's about, I'd say 20-30% of the population, and it's major, like they don't have their canines or they don't have their laterals. It's really tough for the boys because with girls we can get the implant at 18, but they found that any implants they did in boys before the age of 21, that they would fail because boys are not done with their growth spurt apparently. So a lot of boys have to have like cantilever or wear these retainers with a tooth. It's really, we have a lot of patients like that, missing teeth. A lot of molars have baby teeth that never came in. The permanent tooth just never comes in, your premolar, so you have to get implants. Trauma.
Yeah, I was gonna say trauma.
When I was during COVID, my worst emergency was I got called like when they had shut down everybody, but the governor of Virginia had said, please see emergencies. Patient called on a Saturday night, 6 o'clock. He had flipped over twice on his bike and he had gone through all this ortho and expensive implants and he just knocked out one tooth and broke 3 others up front.
Wow.
But so he was really lucky because a physician happened to be walking her dog and a hygienist. And the hygienist actually happens to be working for me. I know this is a crazy story, but she's like, oh my gosh, you have 1 hour to get your tooth back in your mouth. So she called me and she's like, where are you? And I actually came in and we were actually able to save his teeth, but he did end up with 4 root canals.
Wow.
Why the 1 hour to get the tooth back in?
Because studies have shown if you wait more, well, they say put it in milk or spit in your own saliva and put it in, but the best thing is just to bring it in and it's not wash it off, whatever you do. Because they found that it'll just reattach. And the best one is the one that we replanted. I mean, Murphy's Law, get that. I'm like, what? Like all the other ones were hurting, they needed root canals, and this one hasn't. It will need a root canal, I'm pretty sure. But that's the only one. So 3 out of 4 teeth, the ones that broke and got the trauma didn't. I think this one didn't get hit as bad, and like it just came straight out. But yeah. So what we did is we put the tooth back in, we bonded the teeth together. We waited about 4 to 6 weeks. We evaluated him every week with X-rays, and yeah, it's been a long road. But he's 51 and he got to save his tooth. It works
That's
much better
awesome.
with kids. So if you ever anywhere and a kid loses a tooth, just stick it back in the right way. The right way.
I'll
Yeah.
keep that in mind. So I think that's all the time we have today for questions, but we want to thank you, Dr. Yazdani, for joining us today. That was a really great presentation.
Thank you so much.
Thank you. And good luck to all of you.
Thank you. And you guys
Thank
can
you.
follow Dr. Yazdani on her Instagram right here. And we'll see you all tomorrow. We have another virtual shadowing session tomorrow at 7 p.m. Eastern. So see you guys then and have a great night.
You too.
I'm gonna
Take care.
post the attendance quiz in the chat for you guys right now.
Yes. All right.